Hello and happy Interstitial Cystitis Awareness Month. My name is Callie Krajcir, and I am a registered dietitian specializing in interstitial cystitis and other bladder conditions. I am also an IC warrior and currently serve on the Medical Advisory Council of the ICA. And today I'm going to talk to you about how diet affects IC. So first things first, I'm sure when you were diagnosed with IC, you were given a handout about the IC diet that contained all of the foods and beverages that you are no longer supposed to consume now that you have IC. And I'm here to tell you that this diet was not meant to be followed forever. The researchers that created the IC diet meant for it to be used to guide an elimination diet, which is the gold standard for identifying each individual's food sensitivities. As an IC dietitian, I see people over-restricting their diet for way too long and usually end up developing nutrient deficiencies, unintended weight loss, and they may even begin experiencing food fear. This is why I hope this video helps you understand that you may not need to restrict your diet like you thought you did. So, okay, before we get into the elimination diet process, I want you to know a few important things. So first, not everyone with IC is diet sensitive. I like to view diet sensitivity for IC like a spectrum, where on one side of the spectrum, you have people who aren't diet sensitive at all. And on the other side of the spectrum, there are people who are very diet sensitive. And everyone else is basically somewhere in the middle of that spectrum. And you essentially need to figure out where you fall on that spectrum. Second thing is there are many diets out there like low histamine, low oxalate, gluten-free, dairy-free. I've seen it all. And you might have been seeing these diets being recommended on the internet or on Facebook support groups for IC. But there currently is no research supporting the use of these diets for IC. That being said, there have been some reports of people finding success with using these diets. My take on this topic is to utilize the IC diet to guide an elimination diet. And if you feel the need to investigate further, then go for it. And if you're able to work with a registered dietitian to help you navigate that process, because adding in those additional diet restrictions, your diet is you're going to have fewer and fewer foods that you're able to consume, and you don't want to miss out on any nutrients that your body needs in order to function optimally. So working with a registered dietitian is always the best option if you're not sure exactly how to navigate this, and you want to make sure that you are nourishing your body properly. And then the third thing I wanted to mention was food is not always the problem. Don't overlook non-diet triggers like stress, pelvic floor dysfunction, hormone fluctuations, flare-ups of other conditions like IBS. Maybe you wore tight pants that were uncomfortable the day before. Maybe you have maybe you had an argument with a family member. Maybe you have a really stressful day at work. Like there are so many different triggers. And I think what people do is they jump to the assumption that food was what caused their flare up or their symptoms, where because that's something that you can control, that's something we can easily identify because we're eating multiple times a day. But there's so many sneaky triggers that I've seen the people that I work with overlook, and it's really not the food, it's really something else behind the scenes that they were just overlooking. So I just wanted to throw that out there to give you a different perspective, because food, in my opinion, usually not the number one trigger. We'll put it that way. So Now I wanted to take you through what an elimination diet is, how you do it. I'm going to try to keep this brief because I could talk about this forever. But an elimination diet, again, is the gold standard for identifying food sensitivities. Some people will ask, can't you just do a food sensitivity test? Well, these tests are not accurate. And again, the elimination diet is the gold standard. So this is the process of temporarily removing irritants from your diet and systematically adding them back in one at a time in a testing period. And we're really, I want you to know that this is temporary. Okay, that's the magic word here. We are doing temporary restrictions so that you can add more foods back in down the road. We just need to figure out what you're sensitive to, if anything. So the way that I break the elimination diet down is into 3 different phases. We have a baseline phase, an elimination phase, and a testing phase. So in the baseline phase, you are not making any diet changes yet. We want to get baseline data so that you can measure your progress throughout the elimination diet, throughout the changes that you're making, to see if they're making a difference in your symptoms. So you're going to want to keep track of your symptoms. So think pain levels on a scale of 1 to 10 at various points throughout the day. How often are you going to the bathroom? Measuring your urine volume. That can be really helpful to know. Measuring your urge on a scale of 1 to 10. You can also keep track of stress levels. You can keep track of a lot of things, and the more the merrier, because as we really want to have all of this data so that, again, you can compare your progress as you make changes. So that baseline phase lasts typically about a week. You could do up to 2 weeks. Again, you don't make any diet changes in this phase. And if you have already made diet changes, that is okay. Just don't make any further changes. The second phase of the elimination diet is the elimination phase. So this phase lasts about 3 to 4 weeks. And this is where you would be following the IC diet. So there are a couple diet lists out there. The ICA has some resources on that. So you would be eating a bladder-friendly diet for 3 to 4 weeks. And during this process, you're essentially taking those potential irritants away to see if you have improvements in your symptoms, to see if your symptoms are improving. And it's going to be very telling what happens during this period. So if you do have improvements in your symptoms, you may be diet sensitive, okay? But don't get ahead of yourself. If you do not have improvements during the elimination phase, you would be, it's hard to tell you exactly what's happening here, but you could be not diet sensitive, okay? If you have no change in your symptoms, taking those irritants away didn't make a difference. Okay, you may not be diet sensitive, or you may need to take it another step further and maybe investigate something like low histamine or low oxalate. But I rarely recommend that to people just because of how restrictive those diets are. And it's fairly uncommon for somebody to need that additional level, but sometimes it could be helpful in terms of ruling those things out. So that's kind of how I handle that. And then after the elimination phase, you go into a testing phase. And in this phase, you are going to be testing all of the foods and beverages that are bladder irritants back in your diet. So you're going to essentially make a list of the foods and beverages that you want to try. The order can be up to you. Some people like to start with more of the try it items or foods that they think that they're not sensitive to. So you can build up confidence, and you can keep the more common irritants like alcohol, coffee, citrus, things like that. You could keep those towards the end so you can really work up confidence. And each food is going to have a 3-day testing period. So you're going to start with a small amount on the first day, and then you're going to make your way up to a regular size amount on that 3rd and final day of the testing period. So if we take the banana, for example, if you on day 1 if you were testing this, I would say do a bite of a banana. If all is well on day 2, you would do a half a banana. If all is still well, you don't have symptoms on day 3, you can eat a full banana. And if all is well, you would remove the banana after that final day of the testing period. You would take 2 to 3 days off, go back to the bladder-friendly diet. This is a washout period because your digestion can take up to 3 days. It's not super common for people to have symptoms after that first or second day, but we want to ensure that we're not getting the testing periods for each food. We don't want it to get like murky and confusing. So we want to have a 2 to 3 day testing period in between the trials, or what am I trying to say? The testing periods for each of these foods. So after you successfully test 5 different foods, this is how I recommend it for my clients. There are different elimination diet styles out there, but this is my recommendation. After you are successful with 5 foods, then you can reintroduce all of those into your diet, and then you move on to the next 5 foods. And you kind of follow it until you're done consuming, or you're done testing everything that you want to test. Now, if you do have a flare-up on any of the days of that testing period, okay, we're going to make sure you need to look back up to 3 days since you had symptoms and look at your logs, your what you have been tracking. So look at your stress levels. Did you have any stressful events occur in the past 3 days? Could it have been that? Could it have been something that wasn't the food? Are you women on your period? Are you ovulating? That could make a difference. We really want to dig into what happened over the past 3 days so that we can make an informed decision of, okay, I think this food I am sensitive to, or I am not. It was probably, the stressful day at work that I had the other day. So that's the mindset I want you to take through this. You're essentially putting on your detective hat. You're trying to figure out what was causing your symptoms rather than just jumping and assuming that the food was the problem. Okay, so that is essentially how the testing period of the elimination diet goes. If you do determine that a food is a trigger for you, you could always try it towards the end of the elimination diet. You could try it again, just in case there was something else happening. You could try it again with pre-leaf, if you want to see if that is something that you could consume, or this is essentially what the elimination diet is helping you do. It's helping you be informed about your triggers, if you have any. It's helping you reintroduce foods that you might have thought you were sensitive to, but you're not. It's helping you make informed decisions when you are socializing. Let's say you're at a party, you know that you want to consume something that is a trigger to you. Okay, do that. At least you know exactly what's going to happen. At least you can take precautions. You can take your as needed medications. You can hydrate. You can do the things that you need to do. Or if you don't want to do that, you can avoid that food and find something else that's safe for you. Okay. And then the last and most important thing is it will help you build confidence with eating. Okay. Being informed about what your triggers are and having that clarity is really empowering. And that's why I encourage people to do an elimination diet. So I wanted to say just quickly, if you are someone who has a history of an eating disorder, you're currently feeling like you have disordered eating tendencies, this is not appropriate for you. I would highly recommend, finding help through a medical professional like a therapist or a registered dietitian, because this isn't for everybody. Maybe down the road it could be for you, but for now, I would not recommend it. But that is essentially the elimination diet in a nutshell. I also wanted to note a few things before I wrap this up. So first, even if you are diet sensitive now, it doesn't mean that this won't change in the future. For me personally, I used to have some diet triggers years ago, and once I started to figure out more about my triggers and I started to get relief from my symptoms, my diet sensitivity completely resolved itself. And I've had many clients who have noticed the same thing. So if they have stress as their number one trigger and they are diet sensitive, if they get that stress managed, they get that minimized, well, they usually notice that their symptoms start to decrease over time, or not their symptoms, sorry, their food sensitivities decrease over time. So if you are diet sensitive right now, I wouldn't assume that that is how it's always going to be. I would hold out hope that you can reintroduce those things in the future. If you are struggling with nutrient deficiencies, you're struggling with unintended weight loss or food fear, again, I would recommend reaching out to a registered dietitian who is familiar with IC for help working through these issues. And lastly, your mindset is important when going through the elimination diet. If you're feeling stressed or fearful about testing a food or beverage during that testing phase, you can actually create a flare through this stress. So the stress can trigger an increase in your symptoms, and a lot of people find that to be confusing if they have a flare up and they tried a food, but they were stressed about it, they were fearful. So what caused that flare? Was it the food or was it the stress? Well, usually it's the stress. Okay, so I wouldn't recommend testing anything new if you're not in a good headspace. And this is where perhaps a therapist could be helpful. Um, so yeah, I hope this video was helpful for you. If you have any questions, you can reach out to me. You can reach out to the ICA. Again, thank you to the ICA for sharing this video and allowing me to teach everybody a little bit about what I know. And I hope you all find relief in the very near future.